So why the B12 then? So guys, there is a term that you should highlight, and that is folate trap. What is folate trap? Guys, when you convert homocysteine to methionine, what is the name of enzyme? Methionine synthase. And it needs a methyl group. So who is the donor of this methyl group? Vitamin B12 or methylcobalamin. That's fine. Now, when the B12 loses its methyl group, it converts simply into cobalamin. Now, this cobalamin is reconverted back to the methylcobalamin using the methyl group of folic acid, that is methyl THF. So, methyl THF is required in this reaction also, and methyl THF converts back to THF, which is now free pool of THF. So guys, what I mean to say is that if there is no B12, the folic acid, the most important circulatory form of folic acid I explained is methyl THF, that will also be not utilized, because methyl THF is only utilized by vitamin B12 in this reaction, as you can see, right? So if the B12 is deficient, the folate trap will happen, because all the folic acid will be trapped as methyl THF, and there is no taker of this methyl group. So what will happen? This patient will have high amount of circulatory folic acid, but very low amount of free folic acid. Methyl THF is very high, but free THF is very low. And when there is free THF is low, what will happen? It will not be able to convert into other forms required for DNA synthesis. And that's why the megaloblastic anemia will happen. So, strictly speaking, the megaloblastic anemia is caused by the folate deficiency, not by the B12 deficiency. But in B12 deficiency, the folate is trapped. That's why we also say B12 deficiency causes megaloblastic anemia, right? So why we should give both B12 and folic acid to a patient of megaloblastic anemia?